Someone says all human life is here, and that's quite true about Hadrian House.
My stroke. He's canny, isn't he?
People come to life, they can still jive more slowly. They can still do the twist a little bit more slowly, but they do remember those songs and they do sing along to them.
Hands was added and down the wagon way, a pocket full of money and a cartload of food.
They do become an extended family, and you love your family, so you also come to love the family within Hadrian House that you look after as well.
Just getting the right mix of medication for your patients will make a huge difference to them. Medicines usually are given to patients for the right reasons. We've changed people's lives, we've eradicated disease, they can do lots of wonderful things. However, medicines become a problem when we don't use them right.
We were very busy, we filled the home very quickly, and it was always difficult to understand why people came into the home taking masses of tablets.
In the past, residents had plenty of medication, which we feel as nurses is not needed for them.
The nurses didn't have the time to catch up and delve into histories, neither did the GPs.
In primary care, a lot of the time we don't have time to really get to know people, particularly those in a nursing home, so it was really nice to take some time to listen to the story.
So when the medication project came along, it gave us that ideal opportunity to sit down and invest the time with our GPs and pharmacists and look at everybody's medication.
It used to just be the doctor or the pharmacist talking to each other. And actually having everybody around the table, it's just wonderful. It's a game changer in terms of the decisions you make.
Too much medication, it's too sleepy. Sometimes they were drowsy.
Ma'am, are you not talking to us today? Are you not going to talk to me?
The biggest question we have today is really a patch that you take called rivastigmine.
What? The little patches that they stick on you. Do you remember? They make you itch sometimes.
Lita tells us that you're very tired with those patches, very sleepy.
She is, isn't she? She's very drowsy with them.
I suppose the decision between us today is what do we do next? Quite often medicines are prescribed in isolation. What sometimes is lacking is a holistic overview of other medicines the patient's taking and how the current medication fits in with the other regime. If the patch is causing problems, do we think about reducing it or stopping it? Or would you be much happier to let her to be left on it?
No, I think I would prefer her to stop, or, you know, because she seems a lot livelier.
Without it?
Without it, OK.
She's 94, I'd rather she didn't sleep her days away, you know.
Yeah, sure.
OK.
Can I have a cuddle? Yeah.
My dad was born in Hong Kong. He's been a fisherman. He loves fish. He's got dementia. He has irregular heartbeat. Just getting old. He's getting old now.
Your father's got a condition called atrial fibrillation.
Yes.
It's a heart rate that's not regular.
He goes on warfarin and he does have an episode.
It's difficult to say about each way.
Really difficult to say.
What we have to balance up really is the risks of giving them something like warfarin or like a warfarin-like drug versus him potentially having a stroke. And that was a difficult decision for Alex to make. But it's putting the patient back in the centre and saying, it's your medicine, what should we do with it?
How many pigeons did you have?
Oh, I had about 40 odd. Too many.
You raced them?
Oh, aye. I was done well. I won 16 races in 1 year, one time. Yes, I would go more often if I could. And there's too much pain involved, you know.
The things that matter to patients is continuing to do the stuff that we love doing. Little changes to medication can make a huge difference to patients' outcomes. Taking Mr. Stutt as a good example of a man who's in pain and can't do the things he loves doing, by getting his pain control right, we can help him do the stuff he wants to do. I love my job. Because when you speak to patients and you make decisions with patients, it's something that's made a difference. It's just common sense, good care, good practice.
Enjoy yourself. It's later than you think.
Enjoy yourself when you're still in the pink. The years roll by as quickly as a wink. Enjoy yourself, it's later than you think. It's so much later than we think we can sing. Thanks very much anyway for your time.